My name is Sylvia. I came in by ambulance at the end of July. I was really not aware of anything at that particular point. It came to emergency, of course. I was told afterwards that they found that I had pneumonia and ketoacidosis. I was really in a bad way. I can't really remember much of anything for 2 days, but after that, what I remember most were the nurses and the doctors coming in to me all the time, trying to bring me back to the present, giving me my treatments, my meds. Of course, you would expect that, but they were just always there. Okay, you can remember who you are now, right? And they would ask me again who I was, why I was there. After a few days, I could remember that that it was now 2016. That was a big step up for me. After that, it went really quickly. It was kind of a hairy experience for me, and yet it was also a great experience because I went home feeling great, and I'm even better now.
I'm Stephanie Ackland. I'm an RN up in critical care for almost 10 years now.
And I'm Karen Faith, and I'm also an RN in critical care, and I'm going on about 30 years now.
So our job up there is just day-to-day bedside nursing. We care for a very wide variety of patients upstairs, both cardiac and intensive care patients. We're a combined critical care unit. So we see surgical patients, medical patients, cardiacs and neurological. Sylvia was admitted to us with both diabetic ketoacidosis, which means she had very high blood sugar and was experiencing some complications as a result of that. Sylvia also had layering on top of that a nasty pneumonia, so required our services in critical care for a few days to support both her breathing and her recovery from DKA. She looks great. We were laughing because we almost didn't recognize her. I mean, you see somebody out of bed and back into their normal clothes and their normal environment, I would say, and it's sometimes hard to pinpoint them again, but she looks wonderful. And it's always great for us to see these patients come back because we don't always get to hear what happens after they leave our double doors.
And that's so true. In critical care, it's not uncommon. We get patients that are in their most acute state, whether it's the medication or how sick they are at the time. I think we're one of the few units that the patients often don't remember us because they lose a great deal of their time in the unit. So they can come and go, and we never know how they're doing once they leave. So it's really nice to see people come back and say, hey, I'm doing great, and it's nice to see you again.
Yeah.
I'm not sure just how well I would have made it had I had to go any farther. And if this hospital didn't have the facilities that it did have up in critical care, it might have been much more difficult for me to make it through. So I'm very thankful that the hospital exists with all the staff, with all the equipment, with all the doctors. Because right from the cleaning staff all the way to the doctors, they're just wonderful looking after the patients.
Really big thank you goes out to anybody who has donated towards our equipment, all of our supplies, that sort of thing, because we absolutely couldn't do it without of the really vital equipment that we have on a day-to-day basis up there. So thank you very, very much from the bottom of our hearts.
I can't even say thank you enough. I nearly didn't make it, but with their help I did, and I'm ever so glad to be alive. Thankfully, she'd hardly recognized me.
That's what we were laughing about when she showed up. Everybody looks so different out of their hospital gowns and the bed and everything else. She looks wonderful.
Well, I feel absolutely great. I hadn't felt this well in months, really, so it's very special.
And it's so rewarding for us to see our patients come back looking so good too, because we often don't have any idea of what happens to you guys after you leave us, so this is a real treat for us to see.
Oh, that's good. Well, I would love to see everybody one of these days, but I don't like to take up your time either. Because you're really busy up there, aren't you?
Well, I will pass it along for sure for
thanks.
you then.
I appreciate that, yeah. Thank you.